Hey guys, it's Julie Pender. I did come across a very interesting case, so that was kind of neat. His initials are TC. He's an 18-year-old white male. He said he was here for his physical. He reported that his last physical was last year and they didn't find anything abnormal on him. When continuing to talk to him, he did reveal to me that for the last 4 months, he had noticed that he was more nervous and he was very thirsty and he was having trouble sleeping. And he had tried nothing for those symptoms. So as far as history goes, he had no history. His family history wasn't really pertinent to his case. His mom had high blood pressure, and his grandparents, he wasn't 100% sure, but he was pretty sure that they also had high blood pressure, but he didn't really have much to say on that. When doing his physical exam was benign. I didn't find anything abnormal, nor did he report anything on his review of symptoms other than what we have already discussed. His vitals were stable, blood pressure 120/72, his heart rate was 98, respiration's 18, his temp was normal, it was 98.4, and his oxygen saturation was 98%. So with the symptoms that he was having, we kind of already knew what we were getting into because we had his physical labs drawn before he came into the office. So I already had those results back. So I kind of already had an idea what was going on. But my differential diagnosis is, before looking at the labs, would have been hyperthyroid, anxiety, and maybe diabetes. But when I looked at his lab work, everything was normal except for his TSH was 0.010. And then since we had noticed that the day before, we had added on the free T4 and the free T3. And the free T4 was 3.0 and his free T3 was 9.45. And I've seen lots of patients since being in practice with hypothyroidism, but this was the first one with the hyperthyroidism. So what we did was we referred the patient to endocrinology, and hopefully I'll find out what happens before this clinical rotation is done, because I found that to be a very interesting case. Thank you.